I just give brief introduction about Dr. Raju. Dr. Raju has completed both his postgraduate and VR residency from AIMS New Delhi. He is a great innovator and developer. He has developed new universal attachment for payment 132 diopter lens for wide angle viewing system of retina and new adapter for 3D live surgery recording. The patent of both of these is pending. His abstract on innovative solutions for SD surgical recording using commercial camera was awarded at Retina World Congress USA in 2019. So I invite him to give his talk about how to record videos with wow effect, or we can say light, camera and action.
Thank you, Nitesh, for that kind introduction. First, at the outset, like to thank the Jaipur Ophthalmological Society and my good friend Vishal for inviting me here. What I'll be speaking to you in this next few slides would be my experience, or rather a journey that we actually set out around 3 years back. And what Sumit told you is actually a research that we have done over a period of last 3 years. And we have compared so many cameras, looked at so many aspects before we finalized on one camera, and we shot with that. So can commercial mirrorless cameras match medical grade cameras? Most of the times I used to have a tiff with Vishal over this matter, and we used to have a friendly fight on this aspect. I would say for the money that you pay, it's a big yes. Commercial cameras can practically match the medical grade cameras for the amount of money that you're spending. So in my system, I have spent 3 years back, I spent around 2.5 lakhs for the recordings that I'll show you now. And I've not spent anything extra apart from that 2.5 lakhs all these years. But I'll tell you, it's a disclaimer that it's not a fill it, shut it and forget it kind of a thing. It's not a plug and play, because great photos are not produced by costly cameras. They're actually captured by good photographers who know how to use the camera. So the intent of this talk is to make you master chefs in creating great videos, and let's not cook up the videos. Sumit told you what is the hardware required, that's the camera, and you also require the adapter for it. But creating great videos is not just about the hardware, it is more to do with the camera settings. And you should also remember the lighting during the surgery plays a very important part when you are recording surgeries. I accept there are limitations, but we need to work around these limitations to great quality videos. A few aspects of photography that everyone should understand is, first of all, whatever you need to capture should be focused and it should be centered on your screen. We should have proper lighting, and we should understand the settings to great quality images under different lighting environments. That's very important. So if your lighting environments are changing, your settings should also change. So before you start recording your videos, here's the checklist what you should do. First, clean up all your microscope optics. Set your eyepiece to 0. Adjust your IPD. Connect your camera to the monitor or the TV and adjust the focus adjustment. It's very important to make sure your camera is recording what the surgeon is seeing. Most of the times they can be out of sync if not correctly set. So this is the first step that one should start before you start recording your videos. So in our adapter, there is a focus ring. So what we actually do is take a barcode, something like this, and then zoom it up, and the surgeon has to focus it using the ocular. Once the surgeon has focused it on the ocular and his binocular, what he is seeing, the same thing should be seen on the monitor. So we have zoomed it up, and this is the barcode that we are seeing, and the image that the surgeon is seeing through the ocular of the microscope should be also be seen on the monitor of the of the recording room. So that's the first thing. If it is not there, then one should use the focus ring to adjust it. Then you should adjust the camera settings. So adjusting the camera settings will depend on what type of surgery you are doing, whether it is anterior segment surgery or a posterior segment surgery. It's important to remember the same settings on different cameras will not work the same. So we need to individualize it for that camera, the microscope and the optics of the beam splitter. So what I mean to say is the settings need to be individualized for your setup. And most of the times it's a one-time adjustment. So once you do that adjustment for your setup, then you don't have to fiddle too much with it, except for one or two parameters, which I'll tell you subsequently. The camera settings that we need to understand is the light, then the shutter speed, aperture, and the ISO. In this, the light can vary, especially in the retinal surgeries. However, in the cataract surgeries, the light is constant. The shutter speed also can be kept constant depending on the surgery that we do. The aperture, we don't have to fiddle with it. Only thing that we are going to change is the ISO settings of the camera when we are recording. So the photography is built on 3 pillars of exposure. One is the shutter speed. This we have to keep it at double the frame rate. Suppose the frame rate is 25 frames per second, then the shutter speed should be about 1/50. So ISO settings is the sensitivity of the camera sensor to the light. So it depends on the amount of light that you have when you are recording. If you have adequate light, then your ISO settings will be low. If your light is very less, then you need to increase your ISO settings. So however, we should remember that lesser the ISO, better will be the image. So less ISO means less grainy image. So let me take you through my experience. Actually, this is the first shot that I took on my Sony a7S2. It was a rented one, and you can see that it's not such a great retinal view. The reason was that the ISO was low. The next time I set the ISO to 12,500, then we couldn't see the anterior segment. Then we started learning step by step what is ISO, and then based on the view, we were able to adjust the ISO, reduce it or increase it. So once you do it based on your surgery that you are doing and the view that you are getting on your monitor, you just have to adjust it once during the surgery, and then you can keep continuing your recordings. For anterior segment surgeries, actually using these cameras is very, very easy. You don't have to do anything extra. Put the camera in the shutter priority mode. You just have to keep the ISO between 400 to 800 and the frame rate at 25 or 50 frames, whichever you want, and the shutter rate at double that. So once you do this, there's nothing else to be done. It's a one time. Then after that, all you need to do is to record on, record off. That's all is required for anterior segment surgeries. This is the view that I've shot with my Sony a7S2 camera. So you can see how well this recording is. Now I have cropped up that recording to show you the surgical steps. So the area of interest is centered. Now further cropped it up for you to show the capsular axis, further zooming it up. What you can see is the image is focused even though I have zoomed it up so much. I have zoomed it further to the maximum. Still you are able to see the capsule clearly. So what you are seeing here is once you have done a good focusing and the centration with these cameras, especially the one that I have experienced in the Sony a7S2, you are able to get excellent quality images, which I'm sure for all practical purposes can match the medical grade cameras that you get in the market for almost 4 times the cost. This is another video of the anterior segment, and the microscope that I'm using here is not the top end microscopes. These are shot on Topcon microscope 710. It's an old microscope. The glow is moderate, the red glow is moderate, but you can still see the quality of the video is very acceptable for presenting in most of our conferences. So anterior segment surgery, this is shot at around 400 to 800 ISO. Nothing else needs to be done once you have set it. And your recording actually comes out very nicely and beautifully for anterior segment using this camera that we have been using. The color reproduction is excellent. And you can pause the video if you are shooting at a high shutter speed. You can pause the video and take a screenshot of it for your documentation purposes also, if you have some other interesting case. Here you can see the IA being done, and the glow is quite good for this microscope, although it's not one of the top end microscopes that we have. So what I wanted to show you with showing you all the steps is, for anterior segment surgeons, you don't have to bother. Just you can choose one of the cameras and you can really get excellent quality videos provided you use the correct settings. When it comes to shooting the retinal videos, it's slightly different because the lights here vary. And we have different gauges of surgery. You have 23 and 25 and 27 also. And even the endolight that we use, we keep it different, and different surgeons keep the endolight at different distances when they are working. So let me show you how it works. And we also have wide angle viewing systems which have different optical elements which will impact the amount of light that is transferred to the camera sensor. And we also have different surgical steps like under fluid and under air. So this is a video showing you how exactly the things are changing. If you see here, the video to start with is quite okay, but there is a membrane which I'm trying to peel now. And as I'm trying to peel, my endolight has gone close to the retina. As soon as you go close to the retina, this retinal surface is actually here is quite reflective. It's a white membrane, so it will reflect more. So the image becomes blurred or overexposed. But once you remove this membrane, then you can see that again the image quality has improved. This is the view under fluid air exchange. When I'm doing the fluid air exchange, the view is quite good because the sensitivity of this camera is excellent. This is another video. So if you can see here, what I would want you to appreciate is whether this quality of video is acceptable for presentation. So here I'm showing you the use of cutter for a proportional reflex. The dye is aspirated into the cutter and I'm using a proportional reflex to safely inject the dye to prevent a jet stream injury. So if this is the quality of the video that we are able to shoot with this camera, this is a commercial camera, why should you look beyond this? This is another video showing the epiretinal membrane. So the video has been, all my videos have been shot in high definition only, not in 4K. And I have cropped up the image into the area of interest. So you can still see the retinal vessels are crisply focused. The ERM is very clearly seen. The color reproduction is excellent. So all these can only be possible if you use the correct camera settings during the procedure. So you need to see the monitor and slightly adjust the ISO to increase or decrease it. depending on the procedure or the step that you are doing. When you are doing the macular surgery, you need to slightly reduce the ISO because your light pipe is very close to the retinal surface. And once you do that, you can get excellent quality videos like what you can see here in this video here that we have shot. Next comes the question of which format to choose. So we usually shoot in the MP4 format. The other format is the advanced video coding high definition format. So as the quality increases, so does the file size, which you should be able to handle with the newer generation of the laptops. Now, if I ask you which one is better, one is the high definition X AVC HD, other one is the MP4. What is important to understand is not only the quality of the video that you shoot, but also the monitor that you use to view those. So if you are shooting in a very high definition or a 4K monitor, 4K quality, but you are not using a 4K monitor, then it is not worth shooting in that, because unless you have a 4K monitor, you will not be able to appreciate the quality of the 4K videos. So in conferences, this is the limitation that we have. Most of the conferences have resolution of the projectors around 720p, and only recently we are having the high definition projection systems so that we can show our quality of videos. Before I close down my talk, I would like to acknowledge two people here. One is Dr. Deepak Meghur. He was the first to work with the industry and use Panasonic GH4 for surgical recording for anterior segment. And of course, my friend Sumit, he was the first to use the Sony A7S II for retinal surgeries. And it was him who actually motivated me to try it. And after that, we took it to the next level. We also tested it against the Carl size adapter using the LIA paddles, and our work has been published in the Indian Journal of Ophthalmology. We validated our mirrorless camera digital systems with for vitreoretinal surgeries, comparing them with the medical grade cameras. And we are also happy to inform you that our video recording in ophthalmic surgery was also acknowledged by the Survey of Ophthalmology through a letter of editor. So the important thing that I would like to say is that a penny saved is a penny earned, and with a 2.5 or less than 3 lakh camera system, we are able to shoot cameras which are as good as, if not better, so that of the medical grade camera systems. And for all practical purposes, it's a bang value for money. Thank you all.
Thank you, Dr. Raju. A very insightful talk by you and Dr. Sumit. And I've been always, in appreciation of you two guys, using the existing commercial products which were there, and you modified and, fitted to our microscopes and innovated this thing which is costing 1/4 of the system what I am using, and actually giving an almost equivalent quality of videos to us. And it was very innovative and presented in a very simple way, so that our colleagues who are new to video recording are they can use this system with a fraction of the cost of medical grade cameras.